introduce HSRI Director Lindsay Lang. Director Lang.
Thank you. Good afternoon. My name is Lindsay Lang. I'm the director at HealthSource RI, our state-based marketplace for affordable health insurance. I'm happy to report, like Director Brito, that we did have a smooth start to the day as our staff and our call center adjust to the current situation. Our call center management was fully briefed this morning, getting nearly 200 of our staff trained and ready to pick up the phones. We did have a delay to our opening starting at noon today instead of our typical 8 a.m., and that was to allow our team to absorb the new training and prepare to serve HealthSource RI customers. We have had several hundred calls in our first few hours, but the average wait time is very short, so we are able to pick up the phones. The calls are generally brief, and we've had a couple folks in our walk-in center and a little over a dozen folks served over our live web chat. As the governor mentioned, we've also been working with our Navigator Network, a group of more than 100 assisters from around the state who are based out of community-based organizations and health centers. Like our call center, they were prepared earlier today. They know how they can support customers and potential customers while the system is down. We've also provided them with information that is on the cyberalert.ri.gov website so that they can help customers protect themselves from potential fraud. I also want to share how HealthSource RI has been communicating with customers directly. Over the weekend, we've been actively reaching out to customers throughout all of our channels, as well as past applicants and past customers. We sent emails in English and Spanish on Saturday. We sent text messages in English on Sunday. And all throughout today, we've been auto-dialing in both English and Spanish, and those will conclude this evening. These messages are alerting them to what's going on and pointing them to that website. So what should people know, especially since HealthSource RI is in our annual open enrollment period? First, it's vital that people understand that their existing 2024 coverage is not affected by this incident. If they had active coverage last week, they still do. They can still access their health insurance for medical appointments, prescription drugs, and any other needs. Secondly, if they've already enrolled and paid for January 2025 coverage before Friday the 12th, there should be no interruption to that start of their plan in the new year. If they've selected or been automatically renewed, which is something we do every year for renewing customers, into coverage for 2025 and they just haven't made a payment yet, it's safe to make a payment. Whether you do that through in-person, by phone, or through our call center, you can make a payment for your 2025 coverage. You can also go to any freestanding CVS store. That excludes CVS locations in Target stores, and bring the barcode on your HealthSource RI bill and make a payment through the CVS cash register. You can also come to our walk-in location at 401 Wampanoag Trail, East Providence, where there's a 24-hour drop box. Or you can call us at 1-855-840-4774, and we'll get you connected with our payment processing system directly. That payment processing system is completely outside of the RI Bridges system, and it is run by a different vendor. If you're new to HealthSource RI and you're planning to enroll for the first time during our annual open enrollment period, remember that annual open enrollment goes through January 31st, so you have some time. Our staff can answer general questions about health coverage, we can help you understand the application process, and we can answer questions about eligibility as long as they don't involve specific account information that is in the Rhode Island Bridges system. We have a quick quote tool that customers find very helpful. We can help you with that tool. It's available on our website, and it will give you a sense for your options and your cost for 2025 coverage. These are all ways that we can help you get ready for 2025. We can also help you ensure that you've gathered all the information that you'll need so that you're ready when the system is back online. Finally, a note on HealthSource RI for employers. This is our program which serves small businesses and nonprofits with small group plans. The HealthSource RI for employers system is secure. It's up and running, and it is separate from the RI Bridges system. However, the HSRI for Employers program was hosted on the RI Bridges system until March 2019. Deloitte and the state are systematically reviewing what information may have been breached, and we do not have evidence so far that HSRI for Employer customer information was included. This security review is ongoing. If we determine that any information was breached, anyone impacted will receive a legal notification by mail. Again, I want to stress that we're open, we're taking calls, we're available throughout the community at all of our Navigator locations. We're here to help, and we want to help keep residents connected to the coverage that they need. Thank you.